Yes?
Yes, we're great.
Okay.
We're here.
Okay, we're here. Leah, thank you for joining us. This is great. You were just talking about the last speaker, so tell me a little more about what you were saying. Because we don't have to get into politics, but I just would like to hear.
Yeah, no, I mean,
I missed it.
the session was actually really good. It was, they had the affordability czar, new affordability czar that was appointed by,
Trump.
RFK.
Or RFK. Okay.
There you go. And his introduction talked a lot about his economic background and his interpretation of how policies have impacted
Okay.
supply demand. And then but then they had a panel after his introduction. They had a panel with the CFO of BJC, of HCA, as well as a leader from Oracle, and I can't remember what the organization was, but somebody representing kind of the voice of the patient. And then along with him, and then they did a panel discussion. And a lot of the solutions proposed by Casey were related to small business and innovation in healthcare. And that I'm not sure, but
I just made a frowny face. For those not watching on video, I just made a frowny face at Leah.
Wait a second. Small, in what context? So would a small business have an impact?
A little unclear.
You just heard a tagline like small business, and he's like, I'm going to use this?
Well, I mean, I think they're supportive of business, and business that has a solution to most, problems. So healthcare, you can take that potential solution and attempt to apply that to healthcare. I think that I've thought about this a lot, but, healthcare is one of those things where, we have to run like a business. Like, we won't stay open if we don't run like a business, but it cannot be run like a traditional business because the product is not like a widget or a consumer product. It's healthcare,
Right.
which people think of as a basic human right. So how do you commoditize a basic human right and then think only like a business?
Right.
So I think if you take business concepts and attempt to just apply them to healthcare as a business, I think there's some holes in the
But small business isn't like, let's get more businesses to come up with innovative things, or actual small businesses are going to solve the problem?
I think that's where my that's where my frowny face was coming from.
Yeah.
Because I was like, how is a physically small business, let's think of it like that, going to handle the institutional sort of problems that in healthcare?
That was my thought as well.
Okay.
I think.
Okay, so you don't have he didn't go into much detail.
No.
He's like, small business is good. We need small business.
My
I'm like,
brain
what are you
is
talking
attempting
about?
to connect what he may be talking about when he says that.
Sure.
I mean, I know there's been a lot of talk about AI, and maybe he's talking about that type of innovation. Definitely, he was not looking at the government, I think, to try to solve the problem
Right, which
of
makes
healthcare.
sense. Right.
I was thinking, you're sitting there, he's sitting there on a panel with a bunch of very not small businesses, HCA, Oracle. And I'm thinking, who are these small businesses, and what? I guess I understand how a small AI company can innovate and come up maybe with an idea that nobody has thought of, but how is that? And that can make, I would say incremental change to how we do business, but
but Epic controls most of the innovation on that
But
front
again,
anyways,
they're
and that's
not-
not a small
and
business.
they're not a small business. But I'm like, what are they going to try to do? Break up these large companies that they think are not innovative? I don't really.
Or is he talking about?
We're currently making more monopolies and not getting
Well, I also
breaking them up.
I don't
we had
really
this
know.
discussion earlier, and I'm like, if he'd have done any research at all, he would have realized actually large employers are the way that you actually make significant. You could actually do change.
Right.
Because they have an incentive interest, and they have so much.
Right.
Large employers are make up the majority of the health insurance.
Well, and I think about
payers.
we're a medium-sized health system, so we're not a huge health system. But when I'm talking about a small, innovative company that comes up with an AI product, it's very hard for me to adopt that.
Right.
Because there's a lot of concern in healthcare regulatory about like who you're going to work with and how protected your data is going to be. In a small business, there's a lot more risks, even though there might be more, they're more nimble and able to think outside the
Yes,
box.
but you're
more.
less likely to do it because of the inherent risk associated with it.
Yes.
They could fold, they could
Right, which means that how much impact can they really have if large health systems, ultimately cannot, adopt their technology? What ends up happening is maybe they innovate, but then somebody like Epic picks up the idea and like commoditizes
Oh,
it.
that doesn't ever happen. Stop it. Oh, that happens all the time. Sorry. It's my
Disappear.
bad.
They buy them and disappear them.
And I don't blame them. I'm just saying that.
Yeah. I mean, it's interesting. Things are changing so quickly. It's like, I think one of the themes of the last session just overall was, this idea of like incremental change versus transformative change, right? And most of what we're talking about is incremental change to a foundational system that's broken. So I don't know how a small business is going to
Transformational change. Yeah.
Yeah, how we operate. Not sure.
It's hard.
Okay.
Wow.
Also doesn't sound like that had a lot of answers, but
No.
it's fun.
No.
So, how do you think, like in a large infrastructure-focused system, you came to our ants conversation.
Yes.
So was it closed circuit versus the open, like the always on?
Yes.
Always on versus like default
versus
on, default off.
And then there was the modularity discussion. Which
Yeah, so the default on or default off was, so I would say the majority of those health systems are default off, right?
Yes.
And I can see where like a small business starting to start out launching something is default on. They're trying to like innovate,
Yes.
iterate to get to a new innovation. How do you kind of like, knowing you're in the type of organization that is going to be risk averse, that is not going to move as fast, just like you said, can't take the risk on a small thing. How are you guys how are you thinking about how you move forward into this next huge change that we're going through?
That's a good question. I would say like our focus has been on trying to create well-defined and streamlined foundational workflows so that, you understand your data, you understand how the data is created, it's done in a standard way so that you have a product that you can then layer technology on top of. Right now, most of what we're doing is not very well defined, and we're trying to bring it back to be better defined, where we know what the data is that we're creating that we can then use with this type of innovation, AI or whatever it is, to get more automated results. But it's difficult because we're not very nimble.
And you think that's like, is it some of it's like governance? Like you have a governance, like does it have to go to an AI committee? Like, or does that exist? Is that slowing you down, or is it?
I would actually, one of our biggest barriers is really just contracting, getting a contract done that everybody is comfortable with. And part of it is with, data sharing and things. It's about risk provisions and how we're protected from a risk perspective. I mean, those contracts take a long time to get done. And if it takes you 6 months to get a contract done with all the back and forth that happens, like by the time the 6 months is up, all of a sudden this is not the cutting edge technology anymore. And so, I have with my CFO had conversations about how can we be more nimble, especially as we're talking about trying to be cutting edge and adopt technology and stuff, is you have to be able to move more quickly and what's needed in order to do that. But large health systems are not built to be nimble.
Yeah, I think I would say in the last year or two, we've run into like contracts taking a long time. And it's not the people we're working with. It's like everything else is just like, they're apologetic, right? It's like, I'm sorry, this is taking so long.
Yeah.
And I wonder if that's just
very helpful.
I mean, it's certainly inherent in the system, but I also wonder if that's like, does AI make this even more like scary for
Yeah.
legal and others will be like,
Well-
oh, what are we up? What are we actually saying?
I think it's also not just on our side, but also on the vendor side as well. After Change cyber attack, we were trying to get a clearinghouse contract done, and it was like the limitation of liability. They were not offering what we felt we needed from a risk perspective, and we couldn't, meet in the middle. And there was so much change because of change. So much change because of what happened with Change that we talked to multiple clearinghouses, and they were all kind of pulling back on what they would cover, ultimately. And they have everything. They have all of our data. And so, you end up in this battle where you're like, what is the compromise? I mean, there's everything is about electronic data interchange, and everybody has access to this data. And I mean, even if you're not even talking about AI, nobody wants to raise their hand and say, I will be accountable. If this.
So nobody's trying to be accountable for.
Nobody wants to take the risk. It's too expensive. The insurance, on their side, the insurance that they have to get to cover that is cost prohibitive. And they say, we can raise it, but then we're going to have to charge you more. So there's just, generally a lot of risk out there right now. And everybody's trying to figure out how to balance trying to get your costs down with, how much risk you're exposing yourself to. And how do you measure that risk, and how do you define it? It's
That's
complicated.
fascinating. we just had somebody ask us to move our cyber insurance from like 5 million to 10 million.
Yes.
And our current provider refused, so they wouldn't do it.
Yeah.
And then you're going to the market trying to find people, and they're not wrong. There's almost no groups that'll do it.
Yeah.
So
And
it's just
sometimes you have to get
fascinating.
layered policies, so they have to get one policy from one company and then get another policy. So you're basically doubling up your expense.
I know.
So I don't know. I don't know what this. I think it's just it's created by the fact that everything we do now is based on electronic data, and that data is very valuable. And bad actors want it, good actors want it. Everybody wants the data, right? And so how do you protect that? It's hard.
Do you protect it with a small business? That's
That's a great question.
The question's actually small business. The answer is small business.
Maybe it's a place to innovate. Somebody could innovate a small business that
Somebody should-
removes
yeah.
cyber risk.
or
Oh, there we go. Yeah.
or innovate a small business that can provide $10 million worth of cybersecurity
Don't think
insurance.
Yes.
that's going to happen.
Yes. I don't know what the answer
don't
is,
know
but it
that-
sounds like a small business question. The answer.
Small business.
I'm going to use that next time when I don't know the answer.
Just say
Just
small
say,
business.
small
business.
businesses should be able to innovate.
Yes.
Because they're very nimble. They still innovate.
That's what that answer feels like to me. I don't know the answer, so I'm going to choose a multi-purpose.
I did no research.
Yes.
Yeah.
And I picked it and I thought, here's it.
So I'm going to say the thing that's easy, and then you're like,
and he is a very, very
Accomplished
educated
person.
economics
I don't think-
person. He's a professor, PhD, and he's leaning heavily on his understanding of general economic principles. But I think that where I argue is that healthcare just doesn't follow those rules.
Yeah.
Just doesn't.
Well, it's a business like no other.
It's a business like no other, with a product like no other,
Right.
and a client like no other. Yeah.
a payment system like
No,
that. That's the
and
biggest thing
a
is-
regulatory framework
Yeah,
that's
payments
so
like-
inhibiting. Yeah,
The people who consume it don't actually pay for it.
that's right.
In most cases.
Exactly. So disconnected. So
Yeah.
disconnected.
100%.
I don't know how you fix that. I don't really know how you fix. I've thought about it. I've thought about if you go back to the beginning of time and how this system originally formed. I think you did a great overview of that.
Oh, thank you.
And it's how do you undo, 75 years of development, where everybody's been perpetually reacting to, regulatory pressures that have tried to put it on the right direction.
This is like this.
And the reaction to that puts you on a different path that's just as bad or worse. And then, you have to blow the whole thing up.
That's what I say.
But how do you do it?
Burn it down for you.
But how do you do it?
Yeah.
though?
I know
How do you
it's not
burn
a
it down?
solution. This is not a solution.
Small
This is
businesses.
Small businesses.
That's
That's
what
right.
you do.
Thank you. Ben knew the answer. The answer is small businesses.
Burn down the small business? No. That's not what I meant to say.
Well, actually, maybe that's what we need is just a, small business on every corner. to kind of
Well, I
decide
think we
how
had
to
that at one
deliver-
point, didn't we?
deliver
We did.
healthcare.
I got bought up.
We have, yeah.
Well, that's the other thing I was thinking about. Is like we're in this like massive like aggregation mode
Yes.
where even it used to be regional, right? We were aggregating regionally, and now the strategy is we're aggregating in pods across the
Yeah.
nation that have no regional affiliation at all.
Right.
And it's like, what
So
does
even
this
if-
mean? I don't even.
So if there was a small business, it would
It was a small business. Yeah, exactly.
I mean, we're doing it at the health system level,
Right.
which to me just doesn't make any sense.
No.
Like we have in Michigan, we had 2 merged to make Corwell. You
Yes.
know Corwell, right? And it's like, but if you know Michigan at all, Grand Rapids is where Spectrum was, and Detroit, where it's like those, or Beaumont is like those two do not mix. That's like
They
oil
don't
and
share the
water.
same patient population.
Oh,
the same
in any
demographic.
way, shape, or form. Like none of that goes together, and it's like 2.5, 3 hours apart. So
Yeah.
it's not like it's like right next to each other, and like, oh, those totally make sense. Like that doctor's gonna go over there. Like none of that works.
Yeah.
So I'm like, you're merging 2 things that actually don't make any sense.
Well, it's like Advocate.
I know.
Like
Totally different
It's
regions.
two great
Totally
tastes that
different.
taste great together.
Your peanut butter.
Oh,
Your
God.
peanut
You
butter's
got
in
it.
my chocolate.
That's right. No chocolates in my
Wait a minute.
Small business. Small business.
The answer here is small business.
Oh, wow.
I don't even know where we went there.
I don't
I'm
know.
lost.
You were talking about mergers.
Oh,
Mergers that don't make
God.
sense.
don't make
Mergers
sense.
that don't make sense. And that's how I ended up with the Reese's Peanut Butter Cup, which, by the way, is
It is delicious.
It works.
not
So
maybe a
maybe
sponsor. Yeah. Small business.
Please. Yeah, please. Let's work hard at getting a sponsor. That's what we should do.
We could get a Reese's Peanut Butter Cup sponsor.
Yeah, no, let's
Amazing.
try it.
We
Yeah.
could dress Rome from head to toe in Reese's Peanut Butter Cup brand merchandise.
I like it.
He'd wear it.
I think we
Yeah.
could do a whole like market analogy, Reese's peanut butter thing.
See?
We could do merchandise.
It'd be
We could
great.
create a small business around it.
Rev cycles like
I-
peanut butter, like a Reese's. Like, what are we saying right now?
It doesn't make sense when you first think about it.
No, I don't think it
But
makes
it's
sense.
2 great tastes.
Yeah.
Great tastes. That taste.
Yeah.
They taste great together.
Okay.
It's called partnership.
That's right.
It's synergy. What was that movie? The CEO comes out and he's like, it's synergy. And there's a guy,
And
the
the-
old guy's going, what the hell is that? What are we talking about
That's
right
what
now?
we will do that. Small business.
Small business.
Synergy between small businesses. And that's how we solve healthcare. It sounds like I would say you got that from AI, but even AI would have a better answer than that.
I don't know. I was thinking about it. I thought, he's a smart guy. Like, he must be thinking about this in a different way. And I really did put some brain power on trying to understand it.
Or someone's telling them you need to use these words. That's probably more like it.
It sounded a little buzzwordy, but
Yeah. So you need to use these words, and this is what you need to emphasize. And he's like, how do I do that?
yeah. Yeah, his graph on
Oh, he had a graph.
supply and demand. That
Damn.
was in his initial intro. It was like he was just showing basically how these the shoot, I can't remember what they're called, but the taxes that they're rolling back. We're can't remember what they're called now. The supplemental payments.
Oh, yes.
And how
yes,
they
yes.
shift the supply and demand curve. And his second curve, he was saying, basically, the premise of that was that, if we're providing, when the supply demand curve shifts, when we're supplying extra services to Medicaid patients, that basically removes capacity for insured patients. And I was like, the whole premise of this is not correct, because we would never titrate, you know what I mean? Like, say, a patient has Medicaid, so we're going to give the services Medicaid. Now we can't give service to someone else. Like, we're always managing capacity, supply and demand. And just because somebody has a different payer source doesn't change how we,
What is he talking
that strategy.
about?
I don't know.
That makes no sense.
I was just looking at it and I was like, I just feel like, again, it's this idea that the healthcare system operates like other businesses. And I'm like, that's not, we don't say like, oh, we don't want Medicaid patients, so we're going to change behavior. We treat everyone.
Right.
And we're required to treat everyone. So it was, yeah.
Oh,
Wow.
I was trying to understand. I was trying.
I know. No, I feel like
Now I wish I'd gone to it just so I could
I-
have good content.
Yeah.
'Cause that seems like easy pickings right
I wonder
there.
if they're recording these things. Maybe you can catch it on.
No, he's
side.
definitely didn't want that recorded.
Yeah. No, I mean,
Michelle.
we do need some
Yes.
big
just wanna
transformative
introduce you.
change.
This is
So
Michelle.
I don't know what it is. Maybe small business. I don't know if small business can help.
It's going to be a small transformation.
Yeah.
I don't know.
Small transformation.
Hi.
A whole bunch of.
I mean, I do believe in
ants,
the
you see?
iterative versus transformative change.
I agree.
The question is like, what's the transformative change that we could actually stomach? And I
I
say
know
that from
this-
like probably two different aspects. One is like the patients, us as patients, and then probably health systems. What could they actually tolerate?
Weren't there some health systems, I think, in California? This was maybe, could have been 10 years ago now, but they were kind of basically like blowing up their charge masters and reducing their charges and working with the payer to get reimbursed. So basically, trying to fix the distance between
Get
their
rid of the
charges.
contractual adjustment?
Yeah, or at least
Sure.
minimize it, so instead of like we charge this and we get paid 10% of it, they were trying to make it a little bit more equal. I can't remember what health system it was, but I was like, oh, I wonder if that'll take off. But I don't think most organizations did that. I mean, it requires quite a bit of partnership with the payers to make sure from a net perspective that you don't have, a lot of impact. But I mean, really, I think it is collaboration between the providers and the payers. And I think one of the things that's missing from that collaboration is there's some misaligned incentives. I think if we were all trying to solve the same problem, that maybe we would work more together to come up with a solution.
Sounds very California-ish.
It does. I'm from California.
That's right. It makes sense. It actually makes sense that it came out of California. I wonder if they ran into issues with because auto, workers' comp, like that kind of stuff, liability claims, those all work off of charges still, most of them.
Depends on the state.
I wonder what California just has caps on it, so it's like, this is what you get.
We also think about things like, cost reports and stuff. Like if you make significant changes, like there's delayed reactions to types like how your rates are set by government based on prior year cost reports. If you make a big change to your charge master like that, it could impact that stuff too, which you'd have to work with more than just payers.
Or can you not count? You don't count as much charity care, even though it's not charity.
Yeah.
Like the public benefit part, right?
Yeah.
That could be also.
Right. You have to think about, if you were going to make a big change, you would have to think about all of those implications, all of them, and then address them before pulling the trigger. It's not something you can do a little at a time, I don't think.
I don't know. Do you just pull the trigger and make it happen, and then everyone has to figure it out?
Or maybe this is where small business comes in. Something happens when, if a health system closes, because health systems, a small business steps in and reopens it and starts over and rebuilds it in a different, different way. The hard part is that nobody wants to start at the beginning to build a health system or a hospital because of the capital expense and everything that it takes to actually build a building, that does this.
They would turn it into apartments.
Yeah, exactly. So
Elementary school
maybe it would take something failing and then someone more innovative stepping in and saying, I'm going to do this in a different way. But, they would need capital to do that.
Well, I still think, going back to my thing before, I still think large employer working with a health system to figure out a new model, right?
Yeah.
So I think the opposite of what that person said. It's like small business versus large. Large businesses can actually figure out and do something impactful with the health system. They could figure some of this stuff out.
Yeah. I think I think you end up in a situation because we're in such a situation where we're fighting with the payers. We're not working together with payers to solve the problem. And the bigger you get, the payers are really big and we're really big. It ends up turning into kind of like a giant turf war, of who's bigger, who has more leverage in this conversation. how do you come to that conversation as equals?
I think it is
And I
quite
think
a bit, but
that's hard to do, and we've I think decided that the bigger we get, the more we can have those conversations as equals, but then that leads to us not being nimble or changing what we're doing. We're working within an existing framework.
Wow. How are you guys going about your like payer relationships and negotiating, and how are you thinking about it, and how is Hackensack?
I mean, we actually have new leadership in our managed care area over the last year, but we haven't really made, I don't think, any strategic changes. I think, I think most organizations are still thinking about how to make sure they're maximizing reimbursement for the things that that cost the most, and that's inpatient hospital care. And so that's the focus, because that's your biggest line item, right, that you're trying to impact. I think it does, if you're not focused on other sites of care and making sure that you're equally paid well in those areas, it does inhibit your ability to shift services to those other settings. And so, we've been having conversations about where is the market going? Where would patients be served, and how are we thinking about that to make sure that it's beneficial for us to be shifting, care to other settings, because payers don't want to pay if you take a service like infusion and you put it in an ambulatory setting, they don't want to pay you like it's done in the hospital. And so if your contracts aren't set up appropriately, then you're disincentivized to move it to a lower cost, right? Because it's a lower cost setting, it could reduce overall cost of care. But if your contracts aren't set up to reimburse you for it, then you're less incentivized to move that care into that lower cost setting. So I think it's things organizations should be thinking about. I just don't know, if everybody is.
okay.
I don't know how, it's the idea of moving a large Titanic ship and trying to see the future. You really are kind of trying to predict the future and how you distribute, because the payers are thinking about basically it's a market basket, right? They're saying this contract has this value to me. So really it's about thinking about how you distribute. If you get an increase, how do you distribute that increase? Do you distribute it to inpatient hospital care? Do you distribute it to the ambulatory side? And so if you work on increasing your rates on the ambulatory side, you're automatically giving up something else, because they're not going to pay you more in aggregate. They're going to pay you
More here versus there.
That's right. Yes. And so it is a strategic decision to say, we really think we want to focus on this area and we want to shift it. So you really have to know where you're going in order to make those decisions. So I think
it's fascinating when you're talking about this. I'm still thinking back to the ultimate buyer of this is actually the employer,
yes,
but they're not actually negotiating any of it. So you're talking about the actual purchaser is not actually purchasing. They're going through this third party who's doing it for everyone's, but they're making a margin.
right. So there's a lot of hands in the cookie jars.
There's just my analogy before earlier this year is not a good one, but it's we got this eagle, bald eagle near our house, and it's we're on this lake and it's on the island. And then we were just there this weekend, and people are oh, we saw the eagle. And there's these little birds are just attacking this thing all day, just taking it all day. And I'm that's the U.S. healthcare system, where it's everyone's taking their pound of flesh at every different stage because they're all making a margin.
Yeah, but I think all the players have their own perspective, and I think one of the things that we don't do well is to see it from the other entity's perspective. Because, for example, from the provider's perspective, we have a contract. We want to be paid according to the contract. We're going to fight it to the letter of the contract to try to get every dollar. But think about it from the payer's perspective. If that contract's going to pay us, for example, more than charges, and you have a small employer that's signed on to that, they're self-funded, and they have only a couple claims a year, and they have this huge claim, and they're paying more than charges. They're like, why am I working with this payer? Because if I had no contract at all, I'd be paying charges. But now I'm paying more than charges. And it's like, it's like, you got to think about their perspective too. They have a business that they're running. So it's like everybody's, again, like I said before, it's like our incentives are not aligned.
Yeah.
We're serving different stakeholders. Some insurance companies are serving shareholders. They're serving employers. We're serving patients. And everybody's incentives are not aligned.
Do you think that healthcare organizations as employers are good buyers of insurance plans for their employees? Or good negotiators of their own contracts?
It's a good question. In my last organization, before Hackensack, they created their own health plan. And the main...
Just for employees?
Well, that's where it started. And then they did some self-funded groups as well.
Yeah.
But the biggest group was our employee plan, and that was where they were going to learn. That was their learning ground as far as like, how are we going to be a health plan?
Mm-hmm.
I think since they've moved into Medicare Advantage, and I think plan to move into other types of plans, but yeah, it's like they had to learn how to be a payer as well. And but it is because they now, basically you're trying to, you're thinking differently, right? It's about idolization, but you want to, so I think that was interesting direction to go. I don't know, like generally most organizations I've worked at are self-funded, so we're not really buying insurance because we're most large organizations you're paying. So you're basically, most organizations are trying to
keep it in-house.
Yes, exactly. You want to be the
Which
provider
makes
of care,
sense, right?
You want to keep it domestic.
And you're building loyalty. You're
and it's like, obviously your cost is cost.
Yes.
If they're going non-domestic, you're paying the retail rate. So, it's a good strategy, but sure. So you end up with your employees as your patients, a lot of your patients.
Yeah.
Well,
Yeah. Interesting. I don't know where to go from there. Well, I think we're like talking about this like really large subject, but there's like not a lot of answers.
Well, but I think the answer here is small business.
Yeah, I'm aware.
It's always.
I don't know. I do get frustrated in these conversations just because we all know that there needs to be a major transformation, but the path forward is so unclear. And I really feel like it'll take some large disruption. I don't think it's going to come from small business. I think what's going to happen is that providers are going to start failing. And that's unfortunate. People won't have access, and that something will need to change. But every time the government stepped in to try to fix stuff, like we said, it just sets us off in a different trajectory. It doesn't actually like solve the underlying problem. So I'm not sure.
It's so interesting. Have you been watching The Pit? I've been watching.
Yes. Oh my gosh.
In the second season, they've been covering everything, every one of the issues that you and I have talked about today.
Yes.
They have covered in some, even a small way.
Like somebody, Medicaid, they did the ending of the PHE, and somebody got notified about their Medicaid expiring, but it went to the wrong address.
Yes.
And so they showed up at the doctor's office and they no longer had insurance. Yes.
And then
I was like, all this stuff.
They had the one where the person like had to drive past the local hospital because it closed.
Yes.
And they were like, oh, it closed.
That's
and I was
right.
like, oh my God. They're like,
he almost died.
Yes, he almost died.
He needed dialysis.
Yes, he needed dialysis.
I seen that whole thing too.
But I do think it's interesting. It's like they were able to pull in like they had the one person who was diabetic and wasn't taking his medication because he couldn't afford it.
Yes.
But they were working, and
so he had to go back to work,
and then he like fell and like the whole thing, right? But it's like these are all kind of like yes, they're sensationalized, but these are all real world examples of like stuff that's happened.
They had the financial counselor or social worker come and talk to them, and they said they're part of this group that's like the working poor, like they don't qualify for programs, but because they have 3 jobs but they can't afford to pay for
insurance. And when he came back after the terrible accident, she's like, well, it's okay now because we can bail it under this. And his wife was like,
he has
are
a traumatic brain
he has
injury.
Like a TBI.
Like,
he's actually brain.
Actually, it's congratulations. You can afford it now. Like,
don't worry, you're good now.
Like, but I have to say though, you watch that stuff, And it is inspiring because I did take some of that away. And like, we got to do something about some of this stuff.
Yeah.
But as I've always said to my team, it's easy to make a list of problems. I think we all know what the problems are. I think the more difficult task is how do you fix it?
Yeah.
Within this,
Oh, that's
this really rigid framework that we operate within.
That's right.
It's really, really challenging.
For them, they're just trying to bring in stuff that's, and creating this like
Right.
cyber attack thing. Or
Yes.
like these, arcs to show us. It's
Right.
like, oh, okay.
Well, the funny part of that was like, okay, now all the physicians are putting their documentation in. I was like, that would never happen. It would be all the HIM people would be there,
Right.
scanning in all the records. Like, there's no
You
way
guys
they
can't
have the
leave until you
doctors.
put it in. I'm like, no way.
That would never happen.
Would never.
That was probably the least realistic part. Because we know it would be our HIM team there scanning
100%.
24 hours a day. Yeah. So,
Oh. We'll come up with an answer at some point.
That's right. I believe.
I believe in this.
I think we should like meet 3 hours a week to
great.
brainstorm.
Put a meeting on the calendar. Put a meeting on the calendar.
I do kind of think like I watched The Pit and I was kind of the same as you, like, oh yeah, these are all problems we need to solve. Like I should be thinking about that. And then I'm just like, oh my God, I have so much stuff to do
I can't think.
in my job that I like almost have to like compartmentalize these problems that I really think we should solve, like deep down in my gut. Like it's like a passion project.
That's why I do the forum, because part of it is like I can take people out and I can have these larger discussions. Because we're already talking about the details. Like that's why I usually don't bring
Yeah.
like a lot of like, how do you solve this one thing? It's like,
Yeah.
technical stuff seems like, yes, I could do stuff like that, but I try to do more of the like larger conversation,
Yeah.
because I think, what else are we doing? We're never talking about it.
Right. Well, now we have a small business topic for fall.
Oh, I can't wait. I'm just going to title it Small Business.
All business. The solution? Question mark?
Yeah. I was reading about him during his presentation. He wrote a book. Maybe we should do book club.
Oh, I'm scared.
It was based on Trump's first presidency, and it was called "You're Hired." Something like benefits or positives and negatives to a populist president, or something like that. Yeah.
Wow.
He wrote a book.
Okay.
That got him a job.
I'm sure it did.
I bet.
I'm sure it's
He's sitting in a corner somewhere signing some right now.
Yeah, he's definitely signing some books right now. And it's,
Yeah.
all right.
You
Well,
do book club. You make people read it.
I will.
Yeah.
I will. Leah, thanks so much for joining the show. Yeah, it's been super fun. I think we had fun. We talked about big topics. But
Yes.
all good. Come on again. We'll have you on.
Thank you.
Awesome. Thanks.